I think the best results are natural looking rhinoplasties. And there's an art to achieving that. First, I look at the whole face, and I look at the size of the forehead, the size of the midface, the size of the chin, the jawline, whether the chin is protruding or receding, what kind of distance there is from the base of the nose to the upper lip, the distance down here in the lower face. And I'm sort of looking at that, and I'm looking at the width of the face as well. And then I'm looking at the width of the nose, what the bump is like, where the nose starts, how sharp the tip is it flat, is it wide, is it right, is it left, how wide the base of the nose is, what the columella is, this bar underneath, how the nose fits up against the upper lip. Does it make the lip look long or short? Those are all things that I'm sort of looking at. And then when I do computer imaging, I have a really good image of the patient, a side view and a straight on view, that we can look at together and modify those things. And frequently modifying one makes it pretty apparent you need to modify another one. A good example of that would be someone who has a wide bones, a wide nose up here. If you narrow that, a tip that might have looked like it was okay before now looks like it's too fat. So that has to be narrowed. Or if the tip has to be narrowed, sometimes the nostrils look too rounded and they have to be narrowed. So it is a balance of all those things. These are things that we can usually predict ahead of time, and that's one of the ways that imaging is particularly useful. We're going to show you a few images now and go through them on the computer, and you'll get a good idea of what I'm talking about. So in this oblique view, you can see what I call a natural looking rhinoplasty. So the bump is removed, the takeoff is in a natural place between the eyes, the tip is sharpened, the tip is raised up some, and the nostrils have just a little bit of narrowing done. This makes her jawline look better, makes her lips look better. It brings out the pretty features in her face. So this next patient, I was able to refine and narrow the tip in what I would call a natural way. The tip was almost too pointy before, so I made it less pointy. I was able to raise the tip up so it didn't hang down as much. And she didn't need the top of her nose lowered at all. It almost looks like it was, but it wasn't, because now when everything's in balance, the tip looks nice but not too pointy, and the bottom of the nose isn't hanging down and nostrils don't look too big anymore. So that really takes a very pretty woman and makes her even look more natural and prettier. The final case, a young lady who I would say has a little bit of a wide face. She has a pretty good distance between her eyes. Her nose is wide at the top where the bones are wide, and the tip is wide, and the nostrils are a little bit wide. So the surgery started first narrowing the bones at the top, and then once you do that, it's pretty obvious that the tip needed to be narrowed and sharpened, and then the nostrils need to be narrowed. And so altogether, it just looks more natural, and it looks like it fits the rest of her face, whereas before it kind of made her look flat. Now it looks like everything goes together. And again, that's what I call a natural looking rhinoplasty. So when patients have natural looking results, their friends sometimes don't even know that they had the surgery done. Sometimes they can see their mother after not seeing them in 3 or 4 weeks, and their mom might not even be sure about it. But there are real improvements to specific problems that make the patients look a lot nicer. And altogether, the result is natural, so it's not really noticeable that they had nasal surgery.